Welcome back to the Mental Health Matchmaker, the podcast from Building Bridges Psychotherapy, where we sit down with therapists for candid, conversational episodes that explore their perspectives, experiences, and unique approach to therapy. In this episode, we sit down with registered therapist Nikki. We explore a concept that was brand new to me and so fascinating, schema therapy. We talk about what it is and how it helps us understand the patterns shaping the way we see ourselves and the world around us. Nikki also shares how she uses this approach in a flexible, personalized way, tailoring it to each client so it meets them exactly where they're at. Let's get into it. Nikki, welcome to the Mental Health Matchmaker podcast.
Thank you.
I think we should dive into schema therapy right away.
Yeah.
What is schema therapy? Just as basic of a definition as you can provide, and then we'll talk about how you sort of apply that in the therapy space.
Yeah. So I guess the easiest way, the way I explain it to clients usually is I start with what a schema is. I think sometimes in some classes you learn about it in high school, but not everybody knows. But pretty much it's kind of the framework for the way we view ourselves and others and the world around us. You can kind of describe it as like a core belief kind of thing, the way we view the world. And so pretty much schema therapy takes that into consideration. It was developed in like the mid-'80s. And it pretty much breaks down schemas. It used to be 18 schemas. Now they've broken some of them up into like subcategories of self and other. So it used to be 18. Now it's 22 schemas. And then the way when those schemas get triggered, how we kind of deal with that. And the way we deal with that is through one of 3 schema coping styles. And then when those coping styles come up, we also have our schema modes. So kind of the way that we deal with those schemas and the way that those coping styles manifest.
So it's sort of creating like structure and yeah, that's a nice visual that I'm getting.
Yeah, and now that I'm thinking about it, it kind of does help a lot of clients in the sense that, because I can't, as a psychotherapist, we can't diagnose, not like a psychologist or a psychiatrist, but kind of having that framework, if somebody really likes having that organization, it's a great way to not pathologize while still giving them that satisfaction of that understanding of themselves.
Yes, that makes a lot of sense. So it sounds like there's like a lot of pieces to the puzzle.
Yes.
So what does it look like in session? Could you give an example of a potential schema that, would come into the therapy space, and then what the process could look like?
Yeah. So normally what I do is, we'll take a few sessions, get to know each other a little bit, build that rapport. And as they're talking, I'm sort of assessing myself, like, okay, this sounds like this schema or the other, or this sounds like this kind of belief or the other. Maybe after a couple of sessions, I'll give the client like a list of the original 18 is usually what I start with, because otherwise it gets really overwhelming.
Yeah, for sure.
But usually I'll show them the list of the 18 schemas and I'll ask them, okay, let's go through this together. If you have questions, you can ask, and what kind of resonates most with you. They'll say, well, usually it can be a number of different schemas. We have multiple. Some people have more, some people have less, but they'll identify which ones resonate most with them. And then in the next session, because usually it takes a full session, we'll go through the questionnaire to actually identify those schemas. So the ones that I think I see probably the most are abandonment and unrelenting standards.
Do clients identify these themselves, did you say?
Yeah, so at first I'll have them kind of tell me which ones resonate with them, and then we'll do the questionnaire. It gives you like the percentages of each one, and then like maps it out on a chart and shows you where you like answered the most 5s and 6s and all of that kind of stuff. So you can actually see what is the most elevated and what's not elevated. Yeah, it's great.
Yeah, that sounds like very satisfying.
Yeah.
For someone that needs a bit of structure.
Yeah. And that's the nice thing about schema therapy, is because it's so integrative, it uses other kind of modalities of therapy. It provides that structure while still allowing me as the therapist to be a little bit more go with the flow, make it bespoke to the client.
Yes. So it's not like you're opening this door to this system and then you're like, it will tell us the exact dot points for everyone, because obviously as individuals, we are so complex.
Exactly.
So a bit of structure, and then combining that with you as the therapist, being able to dive deeper individually, help the client and their unique story and needs.
Gotcha. Exactly. Which is great, because then when we actually do start, we identify those schemas, then we can kind of take it a little bit more free form. We can really explore them. And so I'll give them the questionnaire, usually takes most of a session, and then we'll have a few minutes afterwards to kind of discuss. And sometimes people are really surprised at what comes up. It's not at all what they said originally they thought they had.
Right.
Sometimes people are like, no, that makes a lot of sense. And then we start to kind of really explore what those schemas mean. Okay, so we have unrelenting standard schema. Usually when I see unrelenting standards, I also see a little bit of that defectiveness and shame, or I'll see a little bit of, approval seeking, or one of the other schemas. They'll interplay. Which one is the most elevated? How do they all the other ones interconnect? And then from there, we can kind of take it more freeform. Maybe we start to, with that framework in mind, the more we talk, the more I kind of see, okay, yeah, so the way you responded here in whatever situation they've brought up in that session sounds like it maps onto this schema. And we can kind of start to dig a little bit deeper.
Okay, cool. So can you take that example a bit further with the unrelenting standards, just so we can sort of get more of an idea into like how the steps could work? And again, for the audience, it doesn't happen like, okay, session 1 we do this, session 2 we do this, session 3 we do this.
Yeah.
I feel like it's worth mentioning that, but what it could look like over time, and knowing that timeline could be super different from person to person.
Yeah, so with unrelenting standards, usually I see that because I see a lot of university students. Usually they have a lot of concerns around procrastination, perfectionism. I see a lot of people with symptoms of ADHD, so that's usually where it comes up most. We'll identify that unrelenting standard schema, and then the next time they come in, they might be talking about an assignment that they had to do that was causing a lot of stress. And so, okay, we start to kind of map it all out. Because I take such an integrative approach, and I tend to be a little bit more freeform, but I'll integrate whatever else seems appropriate. Maybe that unrelenting standards schema is part of what makes them have black and white thinking. So then we'll start to kind of unpack that. How does that map onto the unrelenting standards? What does that do for you? What does that allow you to accomplish? I might take on an IFS approach, an internal family systems approach, and go, okay, so there's this unrelenting standards part. And, it varies from client to client.
Yeah.
It's hard to explain.
Yeah, no, but that does make sense. And I think even when we briefly chatted about it, you also mentioned like attachment theory can come into this as well.
Yep.
So that's really cool. You start to like open up your options, and it's unique to the client, like you said.
Yeah.
But you can pull on so many sources to apply.
Yeah. And that's the fun part of it too. Like you said, it's like I can kind of go, okay, here's your unrelenting standard schema that maps onto black and white thinking. Well, where did that start? Okay, maybe it started because of the way you were raised, which is usually how it works. Usually these schemas start from unmet needs in early childhood. Classic. So cliche, but so much fun.
Yeah.
And so then we can kind of, take that attachment theory approach. Okay, mom and dad were really critical of you. See that a lot. Mom and dad they expected straight A's, and now you feel like you're not good enough if you get anything less than like 90. And then we can kind of, again, start to dig a little bit deeper. A big tenet of schema therapy is what we call limited reparenting. I can kind of, in a safe way that doesn't bring up too much or cause any transference or anything like that, I can kind of be that safe place where they can feel like they don't have to be perfect in the therapy room.
Yes, you're putting it into practice.
Exactly.
Then and there.
Exactly. And then providing that unmet need, and then also modeling for them how to give that to themselves, then we really start to see things take effect. We really start to see that change.
Cool. Have you seen instances where then they're also sort of taking that out into the world and practicing things on their own with the tools that you've given them through schema therapy?
100%. I've had clients that like, it always feels so good. They'll come in and they'll say, yeah, I was going through this thing, or this thing happened, whatever. I was freaking out about it. And then I stopped and thought, what is it that my therapist always asks me? What is it that Nikki always asks me? Okay. And then they start asking themselves that question. Why does this matter so much to me?
Yeah.
What about this is so important? And then they start to kind of learn to dissect it themselves.
It's like the curiosity in the moment, being active in their own daily lives.
Yes.
Which helps us to break those patterns, right? Like that's sort of the key, is like pausing in the moment to then question, like, where's this coming from? Ooh, I love that. I love when you see like the practice of therapy out in the world.
Yeah.
That's the goal, I'm sure, as a
Yeah.
therapist.
Absolutely. And you said my buzzword there, curiosity. We're so used to looking at ourselves and looking at things with judgment. We don't like having these negative feelings. We don't like feeling like we're not good enough or like everybody's going to leave us or like, and we judge it and we try to run away from it. And the more we do that, the more it kind of comes back to bite us in the butt a little bit. But when we look at it with curiosity as opposed to judgment, then it starts to take that power away. And
Right.
it's just, oh, that's interesting.
Yeah.
I'm noticing that this schema is coming up, or I'm noticing that this emotion is coming up.
Yeah.
And you can kind of start to dive deeper on your own.
Mm-hmm.
I don't want to overwhelm you or the audience with
No, keep going. I love it.
all of the stuff, because I also mentioned, there's more than just the schemas. There's the coping mode, the coping mechanisms, and then the modes.
Ooh, tell us about both.
Yes. So the coping styles, there's 3 coping styles. That's kind of the easiest thing to map out. So we either surrender to the schema. So we kind of, like you can imagine with the word surrender, we let it happen. We avoid it, so not running away from it, or we overcompensate. We go to great lengths to make it not so obvious. Yeah. So those are the 3 the coping styles.
Okay.
So if the unrelenting standard schema comes up, we might see ourselves surrender to that. Oh my God, I'm terrible. I'm not good enough. I'm not perfect enough. This will never be enough. And then we kind of
Shut down.
Give up. Or we might overcompensate. We might try too hard. Or we pretend like we don't care. And then from there, we have these coping styles, and then we have the modes. And I think there are like 10 modes or something like that. And this is where it starts to get a lot of fun when you map it onto like parts work and internal family systems. I always ask my clients if they've seen Inside Out.
I love Inside Out. I think we've talked about that once before in this podcast, but like if you need to bring it up again, go for it, because I'm obsessed with it.
It makes me cry every time. Both movies, sobbing.
Same.
But it is like, it's the perfect example of, it's a great example of that IFS, that parts work, those schema modes. You have all of these parts in us. And the modes, you have to kind of break it down as simply as possible, you have your child modes, you have your parent modes, and you have your healthy adult mode.
Okay.
So these are all kind of like parts of you that they come out when schemas get triggered. Maybe if we're feeling that unrelenting standards, the angry child mode comes out and we lash out, or we get really stressed and upset. Usually, a lot of the time, that unrelenting standards comes from a critical parent mode. Or a demanding parent mode, one of the 2, or sometimes both. And so sometimes what I'll do, especially in that case, because that's a really easy one to kind of explain. Okay, we feel like we're not enough. We have that unrelenting standards mode. Okay, well, where is that coming from? Well, it sounds like you have a critical parent inside you. What comes out when that unrelenting standards schema gets triggered? What does that critical parent say? Okay. Interesting. What do the child modes feel? Is there an angry child mode? Is there an impulsive child mode that comes out that wants to go against the critical parent?
So what could the critical parent say?
Critical parent could say a lot of things. A lot of the time that unrelenting standards does come from parents that can be very strict or have a lot of some high expectations. Yeah. So sometimes we hear that critical parent and it sounds like mom or dad or whoever it is. And critical parent says, you're not doing enough. You're not enough. You need to be doing more. Why did you do it like that, you stupid idiot, Yeah. And then those coping styles start to come in. Okay, well, if I'm feeling really angry, I might try to avoid that anger. I might try to overcompensate for it and pretend like I don't care. I might surrender to it and get really grumpy for a little while at everybody and push people away. It varies from client to client, and it gets kind of complicated. It can be a lot.
Yeah.
And sometimes different things come up at different times.
Right. And obviously to the audience, if this is all new, it sounds like we're just saying a lot of things really quickly, but you're in this journey with the client and these things naturally come up in a natural, organic way when you know that it would suit your client.
Yeah. And that's the fun part of it. Like I said,
Sounds fun.
I can make it bespoke to the client. But the main point is let's identify those schemas. Now that we understand that, we can kind of take that more freeform approach.
Okay.
And then we can start using, I also take a very strengths-based approach. I'll use hobbies where I can. So maybe,
Love it.
yeah, it's fun because hobbies are naturally therapeutic.
Yeah.
So people can really get into it. The goal is to get to that healthy adult mode. Notice what's happening in our bodies, what's happening in our minds. I've had clients draw out what their healthy adult might look like. Maybe it's like a little animal, a little butterfly or a bird or what have you. Now they have that visualization. So now when a schema gets brought up, they can visualize that healthy adult and ask the healthy adult, okay, what would you do?
Oh, it gives so much like guidance in a really gentle, encouraging way where they have this anchor in the future and they can see like this is who I want to be. But I feel connected enough to feel like that's possible.
Yeah, it's fun to watch unfold because sometimes, to be honest, like sometimes even I'm like, I'm along for this journey with you, and all of a sudden we get to the other side, we see that progress. I administer the questionnaire again, and it's like, whoa, everything is down to like 0.
Yeah. Do you have any cool stories? You don't need to go into specifics of a particular client, but just like any cool story that comes to mind with that visual art that you were mentioning?
Yeah, so I did have a client during my practicum that I used schema with, and again, it was very free form, unstructured, because that's the fun of it. So we identify all those schemas, and then I did, because they were an artist, I had them draw out what they thought their compassionate self. I referred to it as compassionate self in this case because it just was a little bit easier. Because a lot of time with the unrelenting standard schemas, we lack that self-compassion. We're beating ourselves up. So referring to it as compassionate self, I had them draw out their compassionate self. And originally their compassionate self was just a little butterfly, kind of lost in really dark, spooky woods. And, you know, they brought the picture in. We kind of explored it. We talked about how the unrelenting standard schema came up while they were drawing it. They start judging their artwork. Oh, I wish I had done this differently. I wish I had done that differently. This doesn't look as good as I wanted it to. Okay, so we explore that again with that curiosity. And then kind of as we went along and we, again, that free form, we just kind of talked about it, got in touch with that compassionate self, talked about ways to increase the voice of that compassionate self. Then as we kind of got more into it, we administered the test again, and I had them draw out their compassionate self again. Test all of their usual, the elevated schemas were 0. And their compassionate self was now a crow sitting on top of trees looking out at everything.
That's so cool. I love that it was a crow because I also feel like I thought you might say a butterfly that was bigger and brighter, but I like crows. Like, that's so badass. Like, I love it.
I know, right? It was awesome. And I mean, at first we were kind of looking at it like Pokemon.
Okay, sure.
Right?
Whatever works.
Yeah, whatever works. And that's what I mean. Whatever the client is into. Maybe they're imagining it as the like Butterfree.
Sure.
Like a Pokemon. And then we're seeing it kind of grow into different evolutions.
Yeah. Or even, like you mentioned, Inside Out. Like, even if there's something that is pre-existing that you're like, I can reference this in a really easy way that I've seen makes sense to me. The characters are already there. And so I guess my next question is, what presenting problems does schema therapy tend to work best with? Yeah.
It was originally meant to be sort of an alternative to way of treating personality disorders and complex PTSD, complex trauma, especially with personality disorders, especially borderline personality. So it's kind of a great alternative to DBT, where DBT focuses on like skills and stuff, which doesn't work for everybody. Some people want to go a little bit deeper, but it works for a lot of things. I find that because I'm so obsessed with it, I can make it work.
Find a way.
I can always.
Nikki will always find a way to make schema therapy.
Not
actually. If it makes sense.
If it makes sense.
Wow. Okay. Well, my mind is blown. I feel like I want to look more into this. Like, you did send me a video, and I might be in your Slack DMs being like, give me more.
Oh, I have so many resources, so many.
Okay, well, you'll probably hear from me tomorrow. Thank you for sharing. And you are located in Mississauga?
Yep.
And virtually.
Yes.
Lovely. Thank you for an amazing conversation, Nikki.
Thank you.
That's it for this deep dive episode. If this conversation resonated with you, we'd love for you to follow the podcast or share it with someone who might find it helpful. See you next time.